If you've ever been told your joint pain is just aging or nothing to worry about, but deep down you know something wasn't right, this is the test that could change everything. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health using smart, cutting-edge approaches that respect your body, not damage it. Today, we're covering a topic that's not only central to how I practice, but also essential if you're dealing with unexplained joint pain or a possible autoimmune condition like rheumatoid arthritis. And that topic is why I use musculoskeletal ultrasound in every diagnosis of rheumatoid arthritis that I see. Rheumatoid arthritis is a complex disease. It doesn't start with a loud bang. It whispers. You feel some stiffness in the morning, maybe your fingers swell now and then, maybe it hurts to open jars, type, or grip your coffee mug. But nothing looks obviously wrong on the outside to begin with. So people tell you to wait, stretch more, take ibuprofen. But here's the truth. If we wait until damage shows up on an X-ray, we've already missed our best chance to stop the disease. That's why I use ultrasound. It allows me to look under the surface, to see inflammation directly in the joint that's already there, even when everything else looks normal. RA is not just about joint pain. It's an immune system condition. Your immune system starts attacking the lining of your joints, leading to pain, swelling, warmth, and if left untreated, permanent destruction of cartilage and bone. This damage starts before symptoms become obvious and way before it shows up on traditional tests like X-rays. That's what we're trying to stop. Think of it like a fire smoldering beneath the walls of your house. You don't see smoke yet, but if you had an infrared camera, you'd catch it right away. Ultrasound is like that infrared camera. It catches inflammation before it burns your joints down. We now know that the first 3 to 6 months of RA, what we call the window of opportunity, is when treatment is most effective. If we can diagnose RA early and treat it during that period, people are much more likely to get into remission, avoid joint damage, reduce or stop medications later on, and maintain full function and quality of life long term. That's why early imaging matters. It's about catching the disease before it controls your life. So let's say you go to your primary care or doctor or even your orthopedic surgeon with joint pain. Here's what usually happens. You get some blood work perhaps, maybe a rheumatoid factor or CCP antibody. You get an X-ray, you're told to take NSAIDs or rest. But here's what those tests miss. The rheumatoid factor and anti-CCP antibody are only positive long-term in about 70 to 75% of patients. And in fact, up front, only 50% of people. That means 30 to 50% of people with RA are seronegative, depending on what point in their disease we're catching them, and their blood work can look normal. X-rays cannot see inflammation. They can show damage, such as erosions, joint space loss, or deformity, but if you're at that stage, the disease has already been active for years. Physical examination is helpful, but it is somewhat subjective. Swelling can be subtle, joint tenderness can come and go. You can have active disease with little to see or feel. This is the frustrating part for many patients. You know your body, you feel something is wrong, but the tests say you're fine. I've had scores of patients come to me after months, even years of being dismissed. And in so many of those cases, ultrasound helped to confirm what they already knew, that there was inflammation in the joints. Musculoskeletal ultrasound is a safe, non-invasive way to look at the soft tissues around your joints in real time and within the joints themselves. It's very similar to the ultrasound used in pregnancy. It's just a different frequency and used for joints and tendons instead of babies. The probe sends sound waves into your body and reflects back images of what's happening inside. The lining of your joints, looking at the tendons and ligaments, the bursa and fluid, small erosions or cysts, and most importantly for RA, it can show inflammation in a way that no other tool does at the bedside. I use a special setting called power Doppler uptake, which measures increased blood flow in the joint lining. More blood flow means more immune activity and more inflammation is actively happening right then and there. This is real-time insight that changes everything. So I want you to imagine this. You come into the office with some hand pains and stiffness, no swollen joints, no redness. Your labs have been normal. You've been told it's probably early osteoarthritis. But when we scan your hands with ultrasound, we see thickened joint lining called synovial hypertrophy. We see blood flow where it shouldn't be, meaning in the joints. We see synovitis and power Doppler activity. That's not wear and tear arthritis, that's inflammatory arthritis, and very likely early rheumatoid arthritis. Now we can start the right treatment before you lose function, before you develop erosions, before pain becomes your everyday normal. The biggest benefit and gift that ultrasound gives us is clarity. It gives us early answers when blood work is unclear. It gives us confirmation when clinical signs are borderline, and it's a way to monitor disease over time. It empowers us to say, yes, this is rheumatoid arthritis or inflammatory arthritis, and yes, we're going to treat it the right way right now. Once we've diagnosed rheumatoid arthritis and started treatment, whether that's with a disease-modifying medication, supplements, dietary changes, or biologic medications, we then want to know, is the inflammation going away? Here's the tricky part. Sometimes patients feel better, but inflammation is still active. Or the opposite, patients still have discomfort, but the inflammation is no longer there. It's actually due to other issues. Ultrasound helps us to track that and to figure that out. If power Doppler activity disappears, it means the treatment is working. If it stays, we may need to adjust treatment. Ultrasound also helps avoid unnecessary escalation. If you feel some joint pain, but the ultrasound is clean, it might be a mechanical or wear and tear related issue. That means we don't need to jump to stronger medications right away. This is about precision medicine, treating the right problem at the right time with the right intensity. Every patient is different. Every case of RA is different. Some patients have joint pain but no inflammation. Ultrasound confirms if it's inflammatory arthritis or not. Other folks have mild symptoms but raging inflammation. Ultrasound tells us to act early in those cases. This is where I bring it back to one of my principles of care, which is respect for patient preferences and shared decision making. Ultrasound gives you, as the patient, a visual explanation of what's happening. You're not just taking my word for it, you're seeing it on the screen. You're understanding why I'm suggesting certain treatments. It turns a complex, confusing disease into something visual, clear, and actionable. Patients tell me all the time, that was the first time I understood what's really going on in my body. And that's very powerful. Some common questions I get from patients are as follows. Question 1, can I have RA even if all my tests are normal? Absolutely. That's called seronegative rheumatoid arthritis. It is common. And ultrasound is often the key to diagnosis in those cases. Another question I'll hear, will I need ultrasound at every visit? No. I'll use it at diagnosis, and then again when either we're starting treatment or changing treatment or to check the progress of your condition. For stable patients who are doing well, we won't need to check it frequently. We may still need to scan affected joints every 6 to 12 months, depending on your disease activity, as well as how severe your condition has been in the past. Another common question, what if my ultrasound is normal? That's great. It means we're likely dealing with a different cause for your pain. That could be osteoarthritis, tendinitis, or instability, and that guides us to the right treatment. Another question, is this safe? Yes, ultrasound has no radiation, no injections, and really no significant risk. It's totally non-invasive. And of course, why don't all rheumatologists use it? Unfortunately, it's still not standard everywhere. It takes training, investment in time, and equipment, but that's changing. More specialists are adopting it because it works and is helpful for our patients. So here's what I hope you take away from this. Ultrasound gives us a clear window into what's happening inside your joints. It helps us catch rheumatoid arthritis early before lasting damage begins. It helps us personalize treatment and avoid unnecessary medications. It allows you to see your inflammation and be part of the decision-making process. For me, ultrasound is not optional, it's essential. It's how I make better decisions. It's how I respect your time, your symptoms, and your goals. And it's how we stay ahead of the disease, not behind it. If you found this video helpful, please like, subscribe, and share it with anyone dealing with joint pain or autoimmune diseases. And if you're looking for a personalized, thoughtful, and evidence-based approach to RA, you can visit us at chicagoarthritis.com to schedule a consultation. We offer advanced diagnostics, non-surgical treatment options, and regenerative therapies tailored to you. Thank you for watching, and remember, take control of your health, and as always, live well.